Start with the appendicular skeleton now. We talked about the axial skeleton already. So the axial skeleton was the skull, the vertebra, the sacrum, the sternum, and the ribs, as well as the hyoid and the auditory ossicles. Now we're talking about the appendicular skeleton, which is basically the upper and lower extremities. That includes the clavicle, the scapula, and as well as the pelvic girdle. So we'll go through each of these, help you orient some of the bones that you'll need help orienting. So we'll start up top. We'll start with the clavicle. Clavicle, we see, has a sternal end and an acromial end. Okay, the sternal end is against the manubrium. Okay, we saw that with the axial skeleton. It has a notch for the clavicle. So the sternal end is flat and blunt. Okay, and then it thins out, and it's thinner towards the acromial end. Okay, so we have a flat articulation here, and then it thins out towards the acromial end. Okay, the top part, the superior portion, doesn't have any notable landmarks. The inferior surface, you can see the tuberosity for the costoclavicular ligament here, the conoid tubercle, and the trapezoid line here. And you can see all of those are towards the posterior aspect of the inferior surface. Okay, so that helps you orient the medial surface, the sternal end, versus the acromial end, and then inferior surface and the posterior surface. The posterior aspect has these tubercles and tuberosities. You can also see if you place it on the skeleton, it just tends to go more posterior. So you have this little slight anterior or lateral movement, and then a posterior movement towards the acromial end. Okay, so that's the clavicle that attaches to the acromion of the scapula. So look at the scapula next. So we see the acromion here. It's the lateral aspect of the spine of the scapula. So when you're orienting this, you look for the spine. The spine is posterior, okay? And then you can either look for the medial border, which ends at the inferior angle here, the medial border, and put it medial, or you can look for the glenoid cavity, or the glenoid fossa, where the humerus attaches, and put that lateral. Okay, so that'll orient where the bone is. But you have your spine or your scapula, and then superior to that, you have the supraspinous fossa. Inferior to that, you have the infraspinous fossa. So your infraspinatus muscle attaches down here. Your supraspinatus muscle is up here. We'll look at that in the muscles. So the spine and the acromion are towards the posterior aspect. On the anterior aspect, we have the coracoid process. This is where the pectoralis minor attaches. Okay. And then on the anterior surface, against your rib cage there, this is your subscapular fossa, or the subscapularis muscle is. So you have your medial border, your inferior angle, your lateral border, and your superior border and your superior angle here. The glenoid cavity or glenoid fossa is here. That's a very shallow ball and socket joint here. Most of what keeps the head of the humerus in there is not the depth of the cavity, but it's the cartilage around that, which we'll look at in the joints PowerPoint as well. So that's the scapula. We'll move on down to the humerus. Humerus, we have the head of the humerus here, and then we have two different necks. We have the anatomical neck right here, and then we have the surgical neck. And so this is for surgery, it's a PNU surgery, and this is anatomically. This is what's called the neck. Okay, so anatomical neck is in line, just slightly superior to the greater tubercle and lesser tubercle. So we have greater tubercle here, lesser tubercle here. Now, in the humerus, they're called tubercles. Okay, in the femur, those are the trochanters. Okay, so make sure you remember the tubercle. People, for some reason, always mistake the tubercles of the humerus for the trochanters of the femur. So in the humerus, we have greater and lesser tubercles. And then the anatomical neck, and then below, inferior to that, is the surgical neck. Here, landmark about halfway down, the deltoid tuberosity. Okay, this is where the deltoid muscle attaches. Okay, wherever there's stress on bone, where it's pulling, okay, where this attachment is, you see a bump. Okay, there's more stress, there's more bone laid down there. Okay, so this is where the deltoid pulls. So there's more stress, so it develops more bone, so there's a little bump. So deltoid tuberosity, about halfway down. Okay, and then we look at the attachment to the radius and the ulna. Okay, so we need to get all of our vocab straight at this joint. Okay, so we need to make sure we're oriented correctly. So the medial epicondyle, this is larger. Okay, if you look at your own elbow, okay, you see that big medial epicondyle towards the middle. It doesn't stick out as much on the lateral aspect. So the medial epicondyle sticks out more. This is the medial side. Okay, and then we have one large fossa on the posterior aspect. Okay, this is where the olecranon goes into when we straighten our elbow. Okay, so this is that posterior aspect. When we straighten it, that olecranon goes into this little fossa. Okay, if we didn't have a hole there, we couldn't straighten all the way. The bone would knock into the bone. So there's a little hole there for when we straighten our elbow, the olecranon slides right into there. Okay, so we have the olecranon fossa, medial and lateral epicondyles. Then we have the trochlea. Okay, so if we know where the medial side is, then we know what side the ulna is on. Okay, so the ulna has the olecranon and the coronoid process. Okay, and also has the trochlea. Okay, so trochlear process, trochlear fossa. Okay, so the medial side is the trochlea, the lateral side is the capitulum. Okay, so the medial side, this is where the ulna attaches, that's a trochlea. Okay, the capitulum is where the radius attaches. Okay. Also on the anterior surface, we have a second little groove here, little fossa, that's for the radius. So when we flex our forearm, we flex at the elbow, the radial head can slide into this little fossa and not jam into the bone there. Okay, and then we have the coronoid fossa for the coronoid process of the ulna. Okay, so two little grooves, two little fossas in the front, and one large one in the back. Okay, medial epicondyle sticks out more. Medial side is the trochlea, lateral side is the capitulum. Okay, so we'll look at the ulna and the radius here too. So we saw the olecranon. Olecranon, this is, and then we have the trochlear notch. Okay, this attached to this is the articulation with the trochlea. Okay, so when we straighten our arm all the way, extend our elbow, the olecranon goes into the olecranon fossa of the humerus. Okay, when we flex our elbow, okay, we see this coronoid process. Coronoid process goes into the coronoid fossa from anterior aspect of the humerus. And we have the radial notch, because the radial head attaches into that radial notch of the ulna. Okay, the radial head is proximal, the ulnar head is distal. Okay, so they like to try to trick you on that one. So the radial head is proximal, the ulnar head is distal. Okay, you have the styloid process on the radial side, on the radius, and then distally you have the radial ulnar joint here, the ulnar notch on the radius. Okay, so there's some vocab here that you gotta make sure you know all the little landmarks through there. Those can get confusing because there's 3 bones that kind of attach into there instead of just 2 bones in the joint. So pay attention to that and go over that. And here we have the carpal bones and the metacarpals. And yes, you need to know all of the carpal bones. You need to know where they are and what their names are. So come up with a little helpful acronym for that. We have, so I'll say, what is the most lateral proximal carpal bone? So you go to the lateral, most proximal, and it's the scaphoid. or I can say what's, so I'll ask where a bone is, and then you gotta orient it and figure out where it is, okay? So, so understand that. So I can just say, what is the most medial distal carpal bone? It's just the hamate. Okay. So we have the scaphoid, which articulates here with the radius, and then lunate, and the triquetrum and the pisiform. And then we have the trapezium, here, trapezium for the thumb, trapezium, then the trapezoid, and then the largest one in the center here is the capitate, and then the hamate, which has a little hook on the end here. It's a little hard to see in this picture, but there's a little hook on the end there. So the hook of the hamate. So the whole acronym that we learned when we were going through school was that some levers try positions that they can't handle. So scaphoid, lunate, triquetrum, pisiform, then trapezium, trapezoid, capitate, hamate. So come up with something like that that you can remember that with. And you'll need to know the positioning where medial, lateral, proximal, distal, because that's how we'll ask it on the quiz or on the test or on the practical. You'll have to label one of them. So yes, you have to know all the carpal bones. Then metacarpals here, they're numbered, starting with the thumb. Okay, thumb is 1. Okay, 1, 2, 3, 4, 5. All right, then we have the phalanges, proximal, middle, and distal phalanx, except for the thumb, we have the proximal and distal. Okay. All right, lower extremity, we have the pelvic girdle here. This is made up of 3 different bones that kind of fuse to be one. All right, we have the ilium, which is the most superior. Then we have the ischium, which is the posterior, and the pubis, which is the anterior. Okay, and they all combine at the acetabulum. So all 3 bones make up the acetabulum. This is where the femur inserts. Okay, this is your hip joint. Okay. So with the ilium, you have the anterior superior iliac spine. That's if you have that pokey part of your hip in the front. That's your anterior superior iliac spine. Then you have your large iliac crest. Okay, your hip on the side, iliac crest. And then in the back, there's the posterior superior iliac spine, posterior inferior iliac spine. There is an anterior inferior iliac spine as well. And then we have gluteal lines. So this is where the glute muscles attach. Okay? Again, where there's stress from the muscle, more bone is laid down. So you see ridges or tuberosities or tubercles or something. So we have the anterior, inferior, and then posterior gluteal lines. And then the ilium also makes up the superior aspect of the acetabulum. The acetabulum has a lunate surface, which is the inside here. And at the bottom, there's a little notch. At the end, you can see better with this drawing. It's kind of open at the bottom. This is the acetabular notch. Okay. Then towards the posterior side, we have the ischium. Okay, the ischial tuberosity, this is what we sit on. Okay, this is our sit bone. Ischial tuberosity, that's where our hamstrings attach. Okay, we have the ischial spine as well up here. So superior to the ischial spine, here is the greater sciatic notch. Okay, that's part of the ilium. And inferior to the ischial spine is the lesser sciatic notch. That's part of the ischium. Okay, the ischium. Then we have the ischial ramus. Okay, remember ramus is a bone, is a angled bone. Okay, so ischium, we have that angle to meet the pubic bone. Okay, so we have the ischial ramus and pubic ramus, which comes up to the pubic tubercle. Okay, in this view, you see the ischial ramus here, pubic ramus to the pubic tubercle. Okay, the pubic tubercle here. Okay, that's the surface where we meet that fibrocartilage, where we have that pubic symphysis. Okay. Okay, we also have the articular surfaces here with the sacrum. Okay, this is flat surface with the sacrum. Okay, the sacral iliac joint is a gliding joint because it's all flat, so it glides on each other. And we'll go over joints in a different PowerPoint. We have that gliding joint here with the articular surfaces. We have the iliac fossa. Okay, this is the medial view. This is like a, you know, if you look at the pelvis, it's kind of like a bowl in here, iliac fossa. Okay, and then there's this line here. You can kind of see it here with the drawing, and this dotted line. Okay, this is the arcuate line. This is where the pelvic brim is. Okay, pelvic brim. When we look at the true and false pelvis, we'll look at those. Okay, so the ischial spine becomes important with that, as well as the pubic tubercle and this arcuate line. Okay, so we'll go down to, here's another view of how it attaches into the sacrum. Maybe those are two flat gliding joints, articular surfaces here, iliac fossa, iliac crest here, anterior superior iliac spine, okay, the pubic ramus, ischial tuberosity in the back there, pubic symphysis. Okay, and then here, so this shows us here the here's that arcuate line through here. Okay, that pelvic brim. Okay, so beneath the pelvic brim, that is the true pelvis, true pelvis, all the way down to the ischial tuberosities, back to the end of the coccyx there. So the true pelvis is around the pelvic brim here. So the pelvic brim is the inlet, okay, and the outlet is between the ischial tuberosities. Or I'm sorry, the ischial spines. So between the ischial spines is the outlet. Okay. All right. Now down to the femur. So the femur, we have this large head which sticks into that big hole of the acetabulum. So we have a little depression in the head there where we have the blood vessels and stuff that come out, which innervates which supplies the head and neck with blood flow. We have the neck, and then we have the greater trochanter and lesser trochanter. Okay, greater and lesser trochanter, that's lateral. Okay. So on the front surface, we don't have any major landmarks except until we get down to the medial and lateral epicondyles, the lateral and medial and lateral condyles. On the posterior aspect, we have a couple lines. We have the gluteal tuberosity, the pectineal line, and the linea aspera, and the lateral supracondylar ridge. Okay, these are all where different muscles attach, okay, forming little ridges. Okay, and then we have the medial and lateral epicondyle and medial and lateral condyle. Okay, so on the anterior surface, we can see we have this little articular surface here for the patella. Okay, so the patella is a sesamoid bone, remember? Okay, and we have, it's kind of triangle shaped, okay, where the top superior aspect is the base, okay, and the inferior aspect is the apex, okay, so you can kind of draw that triangle here where the base is the superior side, apex is at the bottom, and the inferior side, okay, and then with this, you can see pretty good here how the lateral surface, so the posterior aspect, this is the posterior aspect, okay, we have a small medial facet, okay, and a larger lateral facet. So the medial facet is kind of more angled, shorter, blunter, okay, and the lateral facet is a lot longer, okay. So you put the apex down, the lateral facet, that long articular surface towards the lateral side, you can figure out what patella it is. That, then we have the tibia and the fibula. So we have the tibial tuberosity. This is that big old bump on the front of your shin. Okay, this is where the patellar ligament attaches. So we have the patella, the kneecap, from the patella to the ischial tuberosity, that's the patellar ligament, and then from the patella up to the quadriceps, it's quadriceps ligament, tendon. So it's a bone to bone is ligament. So it's patella, it's bone, to the tibial tuberosity, that's a ligament. So bone to bone is ligament. So from the quadricep to the patella is a tendon, so patellar tendon, and then, or the quadricep tendon to the patellar ligament. Okay. We have the tibial plateau, which is the superior surface here. We have the medial and lateral condyles, articular surfaces to the femur. And then we have a medial, at the distal end, the tibia forms the medial malleolus. Okay, this is your ankle bone, the medial malleolus, and the fibula. We have the head of the fibula up here, interosseous border, all the way down to the lateral malleolus. Okay, so the fibula forms the lateral malleolus, the tibia forms the medial malleolus, and we can see here the inferior surface here is the articular surface for the talus. Okay, so the talus is what's going to sit here. We're going to look at that in a second. So you can see how the tibia kind of cups around the other bone, your ankle bone. So right in here, that's the talus. So when we look at this, that's this bone here. So here's the trochlea of the talus. So this surface is, so this is a superior view. So right here, that's where that inferior surface of the tibia sits. And then we have the medial malleolus on this side, lateral malleolus on this side. Okay. So just like with the carpal bones, you need to know the tarsal bones. So we have the talus, which acts as the ankle joint, okay, as it articulates with the tibia. Then your heel, which is your calcaneus. Okay, this is your heel, calcaneus. Then you have on the lateral side, you have the cuboid. And the medial side, you have the navicular. And then you have a set of 3 little bones, cuneiform bones. Okay, so people kind of get these confused all the time because they're labeled for their relationship to each other. Okay, so you have the medial malleolus, which is, the medial cuneiform bone, which is on the medial side. You have the intermediate, which is in between the medial and lateral cuneiform. Then you have the lateral cuneiform, which is lateral to the other cuneiform bones, but it is in the middle of the foot. Okay, so it is named for its relationship to the other cuneiform bones. Okay, so when I label this one, it is not the medial or intermediate one because it's in the middle of the foot. It's the lateral cuneiform because it is the most lateral cuneiform bone. So medial, intermediate, and lateral cuneiform bone. Then the cuboid, navicular, talus, and calcaneus. Then you have the metatarsals. Okay, again, labeled, numbered from the hallux, 1, 2, 3, 4, 5. And then we have the proximal and distal phalanx for the hallux, and then we have the proximal, middle, and distal phalanges, phalanx for the phalanges. Okay. With the foot, we have several different arches. Okay, we have the longitudinal arch here, and then we have a transverse arch as well. So you have a medial aspect and a lateral aspect of the longitudinal arches. We have a transverse arch, which runs across the metatarsal heads as well. So there's a few different arches. You don't need to worry yourself too much about that. Just the names of all the bones and stuff. So that is the appendicular skeleton. So that wraps up the skeletons. We'll get into muscles and joints in a little bit.